part of cancer programs is genetic counselors, because we know this is a growing field and the knowledge and the information in it grows exponentially every year. The way that we thought about genetics 20 years ago is totally different than we do now. So genetic counselors are part of our team and a critical part of our team, because if you have a genetic mutation, the treatment may be different, from surgery to how the medical oncologist approaches your care. So it's incredibly important information, and that's why they are an important member of our team.
Licensed and certified cancer genetic counselors are healthcare providers that will meet with patients who are either newly diagnosed with cancer or have strong family histories of cancer to evaluate their whole medical history in addition with their family history to assess the risk for a hereditary cancer syndrome. The role of genetic counselors in the breast program is actually a collaborative partnership with our breast team. We meet with the different healthcare providers regularly, so that would include breast surgeons, medical oncologists, social workers, dietitians, radiation oncologists, and we all work together as a team to identify individuals who would benefit from undergoing genetic testing and having genetic counseling. If we're able to know that someone has an elevated risk for something, then we are able to get ahead of that risk. We can manage someone more closely, screen more frequently. And we can also discuss the options of if there are ways to reduce the risk for cancer. Like maybe there are medications we could take to reduce our risk. Maybe there are surgical interventions we can consider. Where in some scenarios, there's very high risk to develop breast cancer initially, and then there can be elevated risk to develop a second breast cancer in the future. The potential risks about doing genetic testing is actually similar to the benefit, is that once we gain more knowledge about your risk, then we know that there's risk and the stress and anxiety of that there's potential risk of a cancer in the future. It can be very scary. So our goal would also be to make sure that somebody has enough support and is comfortable in the decision as to whether or not they want to pursue this information and gain this knowledge.